When a vein is difficult to see or to identify on palpation, several methods can be used to increase its dilatation. These include lowering the arm below heart level, gently tapping on the vein, instructing the patient to open and close his or her fist repeatedly, and applying a warm compress to the selected site for 3 to 5 minutes to increase vasodilatation. Transillumination or ultrasound may also be used to help locate a vein. These have been shown to improve the success rate of the procedure and to reduce the amount of time needed to perform it. Blood might flash back into the chamber if the tip of the needle has entered the lumen, but the cannula has not yet entered the vessel lumen itself. This problem can be avoided by reducing the angle of the catheter and advancing the needle a few more millimeters into the vein. A valve within the vein may prevent advancement of an inserted catheter. If this occurs, hold the cannula hub in place, remove the tourniquet, and connect the intravenous tubing to the cannula. Running fluid into the vein may open the valve and allow the cannula to be completely inserted. Occasionally, it is possible to advance the catheter when it is outside the vein or when the catheter has perforated the vein's opposite wall. Either of these situations can cause pain and swelling at the insertion site because the intravenous fluids are administered into subcutaneous tissue. When this occurs, the cannula should be withdrawn completely and another cannula should be placed at an alternative site. When a cannulation attempt is unsuccessful, the subsequent attempt should be performed in a vein proximal to the initial puncture site. The most common complications arising from intravenous cannulation are pain, bruising, bacterial infection, extravasation, possibly leading to necrosis, phlebitis, thrombosis, embolism, and nerve damage. Proper sterile technique and the selection of an appropriately sized catheter should help to avoid these complications. Ensure proper and adequate fluid administration or flush the site with saline to prevent the more serious complications of thrombosis and embolism. An attempt should also be made to prevent IV fluid bags from becoming empty, which may cause cannula obstruction from blood clots or the infusion of air. If fluid extravasation or thrombosis occurs, remove the cannula immediately and place a new line if needed.